Hey everybody. So, introductions. My name is John Tembo, and I'm a postdoctoral scientist working on a project called Pandora, which is basically a project that aims to improve the capacity of low and middle income countries, particularly in Africa, which is where we're based, to be able to respond to and manage pandemics, and also be able to do research during pandemics. So since the recent, well, not so recent now, outbreak of COVID-19 in Wuhan, China in December 2019, when the first cases were reported, the SARS-CoV-2, which is the virus that causes COVID-19, has gone on to spread worldwide and become a global pandemic, and one of the worst pandemics we've seen in recent human history. So with that has come a lot of questions and apprehension from the public, and lots of misinformation as well. So we aim to produce these short informational videos just to answer some of the frequently asked questions you guys have, and give you information that will help you and possibly enlighten you, and just give you information about the pandemic and how to protect yourself. So we put out a request on Twitter for questions from the public, and I'll be reading out those questions and providing answers to them as best as I can. So first question we got was, what underlying conditions make you most vulnerable to COVID-19? So there's been a study on this from various people, various groups basically have been looking into this. One was Chen et al., basically Chen and colleagues, who conducted a study in Wuhan. They enrolled 799 patients, and up to the point where they were reporting the study, 113 of those patients had died, and 161 patients had been discharged. So they conducted a study looking at risk factors for mortality or death from COVID-19, comparing the 113 patients who died to the 161 patients who'd been discharged and survived the infection. So basically what was found in this study was that you were more likely to die if you were older. All the deaths occurred between people who were aged between 40 and 60. If you were male, you were also more likely to die. If you had suffered from hypertension, diabetes, cardiovascular disease, you were also more likely to die from a COVID-19 infection. In another study in the Western Cape, they found that you were more likely to die from COVID-19 if you were, again, older, if you had suffered from hypertension or chronic heart disease, if you were HIV positive, if you had a current tuberculosis infection, or a previous tuberculosis infection, you were still at a higher risk of death from COVID-19. In an autopsy study in Zambia, basically they found that 70% of mortalities were male in their study. This was an autopsy study, so this was all people who passed away from COVID-19, and they found that among those people who passed away from COVID-19, the most common comorbidities were tuberculosis, hypertension, alcohol use, and diabetes. So basically the consensus from these studies is that if you have HIV, if you have tuberculosis, if you're male, if you have hypertension, diabetes, and cardiovascular disease, you're at a higher risk of mortality from COVID-19. So these are the at-risk groups who should really focus on preventing themselves from getting COVID-19 infections. So next question was, is there some sort of immunity one gets after having a COVID-19 infection? And the short answer to this is yes, there is some immunity that you get from having recovered from a COVID-19 infection. However, whether this immunity is long-lasting is something that's currently being studied. Current studies, particularly one from Public Health England, showed that you have 83% protection from reinfection if you've previously had a COVID-19 infection and recovered. This was seen to be true for several months following the infection, but we don't know whether this is a long-lasting immunity. For long-lasting immunity, it's still recommended that you get a vaccine, even if you've had a previous COVID-19 infection. And in fact, in some studies, it's showing that if you had a previous COVID-19 infection, you might even mount a more profound immune response when you're given the vaccine. So it might be even more efficacious for you. But, data is still coming in on those studies. Those are the first two questions we received from the public. We'll be making more videos answering more of your questions on COVID-19. So see you soon.